Thank you again for coming, and I would like to introduce our first presenters from the Cannell School of Nursing. Nancy Fairchild and Sue Emery are here to talk about their the exciting things that they did with the pharmacology course this past year. So, without further ado, it's all yours.
Good morning. I'm Sue Emery. I'm the director of the nurse anesthesia program, but I will try and keep you awake at least for the next 10 minutes and not put you straight away to sleep. In a minute, Nancy Fairchild is going to come up here and talk about this course, Pharmacotherapeutics and Advanced Nursing Practice, and the revisions that were made in that course and the role that technology played in those revisions. But we really thought that it first might be helpful to talk a little bit about the course and some of the issues that we had and why those revisions were necessary. So I think we could all agree that diversity is a good thing. Diversity adds to the richness in the classroom, the richness of learning, but it can also present some challenges. And diversity for this course took really three forms, the first being the experience level that the students enrolled in the course had. About half of the students, there were a total of about 90 plus students in the course. About half of the students were from the master's entry program. These are students who have a bachelor's degree in something other than nursing. They come into the college, and after 21 months of full-time study, they specialize and are prepared as nurse practitioners in one of those specialties. The first year of that program is the pre-licensure year, where they're prepared to sit for the RN licensing exam. This particular course falls during the second semester of that program. So they have just had their undergraduate pharmacology course, also taught by Nancy, and they're now entering their second semester of the program. So although the theoretical content is really very familiar and very current, their clinical experience is limited to only about 8 weeks as a student nurse, which really makes the application of the theory somewhat challenging. There are also fifth-year master's students. Really highly qualified undergraduate students can apply to the master's program while still undergraduates and actually enter in their senior year. So in either their junior year or their senior year, they can take certain graduate electives, such as this course. So again, theoretical content's very, very current for these students. They have more clinical experience than the master's entry students, but it's still somewhat limited. So again, theory is really strong, but the application to clinical practice is somewhat challenging. The remainder of the students are traditional master's students, and these individuals have really varied experience. They may have been out of their undergraduate program for any number of years, maybe just 1 or 2, maybe up to 10 or 15 or even more. So theoretical content's a little bit more removed, but clinical practice is certainly very current, and the application to practice comes a little more easily. And one of the extremes, perhaps, of that group are my students, the nurse anesthesia students. In order to apply to the nurse anesthesia program, applicants have to have a minimum of 1 year and often have many more of critical care ICU experience. So their experiential base is really, really strong. In addition to the diversity related to clinical experience, as I said, in the second year for the master's entry and for all of the master's students, they need to select a specialty. And although they're allowed to change their specialty, it's not absolutely carved in stone. This is how the specialties lined up for this cohort that just finished taking the course. So you can see that there are a total of 6 specialties there and a fair amount of diversity. They also select among a couple of roles, either nurse practitioner, clinical nurse specialist, nurse anesthetist is somewhere in there. And that also presents something of a challenge. So I think if you were to ask the students what do they want, they'd like a course that would be focused just for them at their level on their specialty. So we've gotten a lot of feedback over the years, and that has taken various forms. It's been both formal and informal. In particular, naturally, the students evaluate the course at the end of the semester, and also they evaluate the entire master's program at the completion of the master's program. And the consistent message has been that the course was just not meeting the needs of its audience. These are some of the comments from our most recent end of program evaluation. Pharmacology class needs restructuring. That's broad enough. Needs improvement, little information on pediatrics was all but a waste of time. That leaves you feeling warm and runny after putting in a lot of work in a course. Need to offer advanced pharm courses divided by specialty. Again, the need to help with the specialty content and application was really, really clear. So lest you think we just ignored these comments, not so. Different strategies were employed, including and beginning with a change of instructors. So first we tried different instructors within the Cannell School of Nursing. Then it was suggested, well, maybe a pharmacist would add some really helpful content to this. So a PharmD was brought in to give some of the lectures along with one of the nursing instructors. Then it was suggested that perhaps an experienced pharmacology instructor from another school of nursing locally, who had always gotten rave reviews, would really take care of the problem. And again, the verdict was there was no change in the evaluation data. So that led us to our master's program committee and a master's program retreat that occurred last October. We created a pharmacology subgroup. We had representation from the psychopharm course, and I should just say that students that are in the psych mental health track do have a separate pharmacology course that's really geared towards them. So we thought, and that's gotten rave reviews, so we thought we could take some of the good things from that course while recognizing that we couldn't completely model this course after that one because we couldn't develop 6 additional separate courses. So the question was, how can we present core concepts that everybody needed while addressing the needs of the individual specialties and the individual experience level? And it was suggested that we could increase the use of Blackboard and also create either an online or a hybrid course. So most importantly at this point, and to Nancy Fairchild. You're on.
Hi. The dean asked me to be TOR of this course in October. And we basically started work on this in November and had it up by January. And this was due to a very dedicated group of faculty that worked together in eTeaching service, which really helped us. What we did first is identify what lecture content we wanted to continue. And basically, we kept the lecture content very, very similar and made it drug class specific. Next, we identified faculty that were best prepared to teach this content. And as it turned out, we had representation from just about all the specialties willing to teach the content. For example, a pediatric person taught the antibiotics. An adult health and gerontology person did the respiratory cardiac section. Women's health person did hormone replacement theory, contraceptives. Anesthesia, 2 people did the central nervous system, pharmacokinetics, endocrine, and GI things. So it really was truly a team approach. The idea of having some of the pharmacology content online had been discussed for some time, as well as having specialty discussion groups online. So we set up a meeting with eTeaching service to find out what was available. And at this point, I had envisioned that they'd come in and videotape us and then put it up. And, you know, we would just do our regular thing. So we met with Sarah and Scott, who I'm sure you all know, and they explained what we wanted to do. And they said they felt Camtasia Studio would best meet our needs. So what was Camtasia Studio? This is a presentation software. It is for PCs, not Macs, and it allows you to capture, edit, and share a multimedia presentation. It can be used to create a video version of a PowerPoint presentation. It's a standalone product, which means you can record, edit, and share your video presentation on the same platform, and I will demonstrate how to do it today. Keep your fingers crossed. Recording is very simple, and you can record basically anything that's on your computer screen, from PowerPoint presentations to video clips. And you also have the option of importing graphics and videos from other sources. There's also editing options, which allows you complete control over the video so you can cut and splice. And there was one faculty member that ventured into that area. So this sounded exciting to us. So the next thing we had to do is approach our dean for money to buy the software. And Dean Gennaro was very generous and allocated money for 10 software licenses plus the headphones. So faculty were then given the option of either presenting their lecture in class, and the class was Monday, 4:30 to 7:30, or use the narrated PowerPoint using Camtasia. And all but 3 lectures were used the Camtasia studio presentation. eTeaching then set up a training session for us. They also provided one-on-one help as well as a handout for us to review before we actually did it. Any problems we had, they were very responsive to our needs. They came over and helped us with everything. In the training session, they also told us to dress up as if we were giving a lecture and not to record in our pajamas. So when I did mine, I had my quota of coffee, got all dressed up, got on my dining room table, shut off. I took my regular landline phones out. Of course, I didn't shut off my cell phone, but no one ever calls me on my cell phone, except while I was recording, my phone rang. And then just as I was ending, my 2 cats went flying across the dining room table and knocked everything off. So I ended up redoing it, which was fine. But it was better, I think, the second time. So we did make guidelines also for the lecturers. Since it was a 3-hour class and we were also going to use discussion groups, we said keep the lecture to no more than 2 hours. They were to submit their presentation on a memory stick to my faculty assistant the Wednesday prior to their scheduled Monday lecture. They were also to submit the reading assignment as well as their PowerPoint slides so the students could download the PowerPoint slides and follow along with the Camtasia presentation. They were also responsible for exam questions, okay, and the exam questions came just from the lecture content. They were also required to check the Blackboard Vista site for any questions on their lecture content. We told the students to email only within the Blackboard Vista site, so that they would have to go back up to when their content was tested on. I did ask faculty after the course concluded if they prepared any differently for this Camtasia presentation than for normal lecture. And most of them said they did not. A few said they actually had to add a few slides. Most enjoyed using it. One limitation cited was the fact that they missed the questions from the class and discussion that does occur during the classroom. Also, it's important to note that they did make an effort not to just read from their PowerPoint slides, and I'm sure you've all heard students really do not like that and feel it's a waste if they come to class and someone just reads everything that's on their PowerPoint slides. So they did try to make an effort not to do that and to be animated as they spoke. Okay. As Sue pointed out, a prior problem with the course had been showing application to the specialty. So as a result, we created 6 specialty discussion groups, and 1 to 2 specialty faculty were assigned to each of these discussion groups. And the purpose of these groups were to apply the lecture content to the discussion. So the specialty faculty were responsible for providing weekly cases with discussion questions, as well as any pertinent articles or algorithms that would go to in their area. Again, the weekly work was due the Wednesday prior to the scheduled Monday class. Now, you need an incentive for students to participate in the discussion group. So what we did for incentive was we said that if they did meaningful contribution, and of course that arose all kinds of questions on what is a meaningful contribution, how many times you have to do it, etc., which we ironed out. I would add 2 points to their final grade. Okay. Also, a lot of the content that they learned in these specialty discussion groups would be applied to their case analysis, which was worth 25% of the grade. So there were 2 incentives there. Both lecture and discussion topics opened on the Friday before the scheduled Monday class, and discussion went from Friday to Friday. Another anticipated problem which was addressed was the technical aspect of using this. I had done an online course a number of years ago, and that was one of the problems. They would email me with all these technical things that I could not answer. So eTeaching put up folders for us on common technical problems and how to solve them. And they also gave an email address for them to contact if none of these things worked. And that seemed to work well. There was, however, one student who had dial-up, which did pose problems, and she did end up dropping the course, although she could have come in and used computers in the school. So now I'm going to show the site. Okay. We have the regular thing of getting started with Blackboard Vista. I will just do this quickly. Probably all familiar with this. Oops, I need the student view, sorry. Most of the students were familiar with Blackboard Vista, but we did have a number of older students. And it was interesting. I did have some come up at the end and said, I really didn't think I'd like this, but actually did. So this shows the operating system, best browser, et cetera, that they need. Then we had technical troubleshooting. And this shows if you see a black screen with no content, if you see an image, don't hear the audio, if you're unable to resolve the problem, where to go. And then we had the test video.
This is a test video. If you can see and hear this video, you will be able to see and hear the others in your course.
How's that? That was Sarah. Okay. Now again, these were opened week by week, and as you can see, quite extensive. Their tests, they had 3 non-cumulative exams, and of course they all have to know where's the test coming from. It came from the course folder. So everything that's in here was testing. So let me just show you week 4. And we have the person who did this in the audience, actually. And as you can see, she did her handout that they could download and follow along. The reading assignment, and here is, okay, I'll show you 2 Camtasias and then a digitalized video, just some of it. And one thing, when I start this, you'll see on one side of the screen, it lists all her slides. And what's good about this, if there was a certain area they didn't understand, you can click on that slide and it will go right to that slide. Takes a little time till it goes there. Okay, here we go.
Hello everybody, my name is Kelly Stamp. I'm an adult nurse practitioner and I'm going to talk to you today for your Annual 420 Advanced Pharmacology course about CAD, heart failure, and dyslipidemia. We're going to begin our lecture with coronary artery disease in children. Some of the conditions that we may treat patients
and you can
for
skip,
are
like if I want this.
a few minutes.
See, you can go right to adverse effects.
Many of you who have worked in
another one you can
reduced
skip.
tachycardia. Next slide, preparations.
Okay.
Here's where we're going to talk about the type of tabs and type of preparation.
Okay. And let me show you just one more briefly. And this is Sue Emery's on endocrine. Notice I'm not showing mine. I did the herbs. And I must say, all the faculty were excited about doing this, which was good.
Hello, everyone. This is Sue Emery. I'm going to be speaking with you today about the endocrine system medications. And it occurred to me as I was preparing this lecture that this talk, much like the others you've had
Now I can move
earlier
ahead
this
to the
semester,
islets of
will continue to
Langerhans.
have the islets of Langerhans. from the Guyton textbook. There are 3 cell types actually Guyton lists 4, but we're only going to talk about 3 for our purposes. There are beta cells, which represent 60% of the cells of the islets of Langerhans, and they secrete insulin. The alpha cells represent...
Okay. So that was a course folder. Now we also, as Sue mentioned, there's a psychopharm course that group has broken out, and they have lectures. So they did videotape 2 of the lectures, one on major depression and one on anxiety disorders, and they were digitized and then put up on Blackboard. I'll show you part 2 of major depressions. Now, one of the problems, as you'll see, it takes a little while for it to come up. There it comes up right away. Usually it takes a lot longer, and so the students were emailing me saying, it's not coming up, not coming up. I said, you just have to wait.
Because I thought that's what we were supposed to be doing all along. But also someone just commented that you're supposed to practice based on studies in your literature. So as far as polypharmacy, if I'm not against polypharmacy, I just want to see the evidence that it works. There isn't very much. While there is evidence for a monotherapy, I would argue we have a lot of choices for monotherapy. You would run through 4 or 5 trials of very different antidepressants before ever combining any.
And some students love that, and some like the Camtasia better. So when you have 92 students, it's hard to please everyone. Okay, so that is the course. Now let me go back to the discussion groups. And as you can see, there's 6 discussion groups. We do have a psych folder, and what she did was, from the psychopharm course, put her syllabus with the links for any readings and access to that for us. So that was good for students. Okay, so here is adult health, and again, these were opened up week to week, and I will do the endocrine because it's okay. If you notice on the left side are required readings. They have American Diabetic Association algorithm. They have gestational diabetes injectable and all those things they're responsible for. And then here you have the weekly discussion where they have a 54-year-old male, newly diabetic, you know, and what would you consider? And then students would respond there. And I showed them during the first class how to do this and how to post, so they knew how to do that. So that's adult health. Then pediatric, week 7. Again, they have a 15-year-old who was obese with type 2 diabetes. And again, they have specific reading with regards to pediatrics there. Family. Now, family covers everything. So they were told to just participate in discussion in family, but to look at the other folders. And some of the readings and stuff were shared. So they all got together, especially faculty, all got together and did things. And again, she had a 45-year-old diabetic. Okay, forum. Gerontology and adult health were told to also read each other's folders. And again, she had things specific for geriatrics and had a 68-year-old, which I don't consider that old. looks younger all the time. So then I'll wait on that. Women's health. Again, a 25-year-old with gestational diabetes, and again, readings for that. Anesthesia. Anesthesia did a little bit different. They had, they really, if anyone needs to know their meds, you want the nurse anesthetist to know it. And they have a lot of additional courses actually on meds. So Sue had them buy the textbook that they'll be using this summer. And here she had study questions for each of the weeks that they might do, and the reading assignments. And then for week 7. And she is also going to be using a lot of these scenarios this summer and expanding upon them and also using them in simulation. Okay. All right, now what I am going to do, I think I covered everything there. I am going to show you how to do it. Okay. And if I can do it, believe me, anyone can do it. As I tell people, I still think of the computer as a little miracle. So, okay. All right, I just made a 3. And if you go to TechSmith, I think it's .com, you can try this free for like 6 months, the Camtasia Studio. Okay, now you see up here all these buttons? These all have to do with Camtasia. That's the record. The microphone is highlighted, which is good. This is the record camera, which we don't need, or that. This will show right here that my microphone has been selected. Okay? And you can use other things. So when I click record, you'll see down here, it will show you if you're all right for sound. Now, some people were very soft, and that was one of the problems we ran into, that people had to use external speakers or headphones to hear. And whenever you turn this all the way up to the end, you can hear every breath you take. So this is not good. So this should be all right. And this just repeats what I said. You plug in the headset, open the PowerPoint presentation, make sure audio device has headset selected, make sure microphone icon highlighted. Look for record button. You click the record button, speak into the microphone to test it, click record. Then when you're finished, you click escape or stop, and a file browser will open, which you'll see in a minute. You can also pause during the presentation, and there were a few people who didn't realize that and spoke the whole time and were like out of breath by the time they finished. But you can do Control-Shift F9 and pause it and then restart. And then to stop, I'll do Control-Shift F10. Okay. All right, so stop the presentation, stop recording. All right, it's narrated PowerPoint, that's fine, saved, and it'll be saving into my Camtasia Studio folder. And I'm going to produce your recording. Now, a lot of people did not produce their recording, so they stopped here, and then they went to their Camtasia Studio folder and dragged it onto a memory stick, and then gave it to my faculty assistant to produce. Okay, but we're going to produce it. Okay. Okay, and that's next is fine. You have to make sure you have an up-to-date flash player, which is checked, but you can see it can also go on an iPod, iPhone, MP3 player, etc. Now, we did not allow the students to download this onto anything that was up on Blackboard. So, okay, so that's next. Okay, then this was more or less experiment with the things. We changed this to 1024 by 768. Next. Okay, that's fine. Next. Okay, production, finish. Now it is being produced. Now, since I only use 3 PowerPoint slides, this will go quickly. You can imagine how long it takes for 1 to 2 hours. It does take several hours to produce. You need to leave your computer on while it's being produced. However, you can minimize it and go about doing whatever else you are doing. And at this point, I'd like to have my faculty assistant stand, because without her, couldn't have done it. Michelle Hubley. She was absolutely wonderful in getting all this stuff up and was excited about doing it. As she said, this would really be fun if this is all we had to do. Because it was fun, and it was also fun to see how excited everyone else was to use it. Okay, just about finished. Okay, and you want to finish. Okay, you can preview it here if you want. Now what you do is, if I've got this right. I don't want that either. You need what's known as a web DAV folder, which is in your network places. And eTeaching can help you set that up. That serves as a link to Blackboard Vista. And here it is here. Okay, and that's all the stuff that we put up there. Then I open my Camtasia folder. And what I need to do is, you see where it says narrated PowerPoint? I drag that, put it in the WebDAV folder. You don't open that folder. There's about 6 different things in there. You bring the whole folder over. You don't bring the individual contents in. And that's all set. Okay, so then we go to Blackboard. Go to Build. Okay, I have a test thing down at the end. Open this up. Add file, browse for file, and this is the WebDAV folder that opens up. And I look for my narrated PowerPoint folder. There it is. Click on that. Then I click the controller, put OK. That's there. Go to Student View.
And this just repeats what I said. If you plug in the headset.
Yay! It worked. But just think, if you have a snow day, okay? Students are all excited they have the day off. And then you go do your Camtasia PowerPoint, email them all, and say the lecture's up on Blackboard. It'll be tested the next session. So I could have actually used that. All right, let me just go over. So we did hit a few problems that I will go over. Okay, we did have a few technical problems, some of which I said. One of them we found, and we blamed it kind of on pop-ups. For example, if they come to you, when Iron Mountain comes when you don't want it and says you want your computer backed up now, do you want updates now? And it seemed to throw off slides with voice. That's what we traced it to. So make sure you're backed up before you do the Camtasia, and maybe leave it on an hour or so in case they want to do any updates. As I mentioned, some had difficulty hearing a few of the presentations, and just using external speakers or headphones worked fine. Digitalized video with the PsychoPharm, a lot of people were not waiting long enough for it to appear, so that was fairly easy to correct. With regards to the discussion groups, a couple of them were a little large, so that for the future we'll divide those into 2 different groups, and also do specific guidelines for the discussion group. Also, we're going to go to regular emailing as opposed to Blackboard Vista, because people were not routinely checking Blackboard Vista, where you're more apt to check email. Evaluation, majority liked the format. I did a written evaluation after their last exam, which isn't always the best time to do it, but I wanted some information. And 82% rated it good, very good, or excellent. They found it very convenient, well organized, comprehensive. They loved the fact they could do it at home. A couple of students said they had to make sure they sat down to do it. And some of the ones that weren't crazy about it waited till right before the exam to sit down and listen to all the Camtasias at once, which is not what it meant to be. They liked the fact that if they had difficulty with one section, they could go back just to that specific section. Because I have students that tape record my lectures, but they're stuck listening to the whole thing. And they felt expert lectures, and they liked the content. Some of the things they missed, some missed the classroom setting, and you can't deny a lot does occur in the classroom setting. Some just do not like online courses. Now, because this was done, basically starting in November and ready by January, it was not advertised as primarily an online course. And that some would like the reading assignments on the syllabus, which is easy to correct. Discussion evaluations, very positive on there, and many have thought that was one of the strengths of the course, that they could actually see application from the lecture to their specialties. Helped integration. Some actually said they forced them to research beyond the regular reading. That's always nice to see. And again, the smaller groups. Some students wrote too much, particularly initially, went on, and it was like a mini thesis. They took every point. So we tried to stress, take one point in this. It's supposed to be a discussion, don't answer everything. So I'm going to make more specific guidelines on that. They also wanted more faculty interaction in the discussion groups, which we're going to have a meeting at the end of this month, and we'll talk about that, which should be easily resolved in the guidelines. Changes for next year, we're still going to have the first 2 classes in class. At the end of the first class, we're going to have them meet in their discussion groups so they get to know each other. And they get to know me by having it in class, the first 2. We're going to add a few more things to the technology folder, for example, if they can't hear what to do. Again, smaller discussion groups with guidelines and feedback. Some of the Camtasia presentations, particularly the ones that were very soft, will probably be redone. We're going to advertise, at least on the website, that it's primarily online. Reading assignments on the syllabus, and we'll use regular email. One great advantage of this that I stress to the students, since most of them are now just entering their clinical part of their master's program, is they have access to this site for several years. So that if they have to look up medications or need information, they can go back to it. And I think that's a wonderful thing. It's very accessible, and it's great for content review. So that's it, and I'll be glad, Sue, and I'll be glad to answer any questions. Any questions? Yes.
Sorry to go right to the technical questions. But, the Camtasia produced PowerPoint presentation that you put up was very short. I noticed it came up very, very fast. Very long presentations, and also for the video. Did you have to use the streaming server, or was everything put right on the? No,
it was just put right. It was just put right up. The 1 to 2 hour lectures were just put right up. They only took longer to produce.
Yeah. But they came up fast. And
yeah.
What's the pleasure that Blackboard Vista is using? Is it using something that's already on the students?
I think it is. Do you know?
It's just
the Flash Play? Flash.
It's just a Flash player.
Yeah.
The way they produced it.
Yeah.
So uploading these files did not take you a long time to upload them to Blackboard?
A long time uploading?
Do what you need to do, but there could be a couple of people on. You continue to go about doing what you're doing, but it does take start to finish. And then you really just click a couple of buttons, 10 minutes maybe of actual doing. You had a
Yeah, it was just an email address. What was the volume?
And was it in the beginning?
I don't think. A lot of times they email me first still, But it was usually when they couldn't hear, and I had the solution. And I also, when I found a number of students were just not waiting too long for the second one, I just emailed them all, about that. If you can't hear, use external speakers for fun, and to wait, Yes.
Two questions. One was, how big were the discussion groups and what size would you like them at? And the other was, what will you be using email for?
The discussion group depended on the size. Like pediatrics was 26, which is too high. So we were thinking 10, maybe in the 10 to 10 range would be good for discussion. Email would be for questions on content from the presentation.
Great presentation. Did any of your faculty or math classes, or was it all?
It's all PCs, and we did put a PC on one that's universal that anyone can use. That's just going to be used for Camtasia. So I don't know whether anyone's here that used that's Mac, but no, we had 2 Mac users and they both used the PC. I think there is a program for Mac, is that correct?
ScreenFlow, but we didn't really experiment.
Yeah, we didn't experiment with it.
Do you know the size of the file for one of your Camtasia productions? 2-hour lecture. How big is it in terms of megabytes, gigabytes? I don't know exactly, but they're 100 to 200 megabytes. I was doing some QuickTime ones, which I think are much smaller than Flash. And QuickTime ones are around 250 megabytes. I guess would be the Flash gigabyte or more. That's just a guess. I'm just wondering what it was. I think the newest Camtasia used it for that. Not to get too techy, that H.264 codec that QuickTime was. Sorry. Should be somewhat of that.
You said you got 10 licenses.
Yes.
What's the cost of one license?
It was under 200. I think it was 179, and then a little more for microphones, so maybe about 200.
Did any one of your students report about bandwidth issues in getting to these files? Any one of your students reported bandwidth issues on their end?
They thought bandwidth issues.
No. Except for the dial-up. That was the only one that had problems. Was the dial-up. Yes.
Why did you want them to be downloaded on iPod?
I don't know. I think we thought about, I thought about, whose property it is and this and that. So we just decided not, and no one questioned it. I mean, no one asked, what to do with it.
I was thinking, this was undergrad. That's how they live.
Yeah.
So what would be the negative?
Probably wouldn't be. I mean, that's something. But I think for the first time through, it's just...
Really, they could put it up on YouTube.
Oh, yeah. Yeah. So I think we're thinking more as a result.